Mastering the Art of Delivering Bad News, Top Tips and Pitfalls. By Medical ICT Solutions. Hello and welcome to this video on how to break bad news. Breaking bad news is one of the most challenging aspects of being a healthcare professional. However, it is a crucial part of our role in providing high-quality patient-centered care. In this video, we will outline a step-by-step approach to breaking bad news that can help you prepare, communicate effectively, and support your patients and their families. Step 1. Preparation. Before breaking bad news, it's essential to ask your patient if they would like a relative or friend to be present. Consider using two-way acting to put them at ease. For example, I have asked a nurse to sit in with us today if that is okay. Step 2. Set the scene. Set the scene by explaining why you are there. For example, I have come to talk to you about the results of your tests. Step 3. Check understanding. Check your patient's understanding of their situation. Ask questions such as, can you tell me what you understand by what has been happening so far? And, do you know why we did the CT scan and what we were looking for? Step 4. Ask about specific concerns. Ask your patient about any specific concerns they may have, including psychosocial worries such as childcare. Gauge how much information they want to know. Step 5. Warning shot. Prepare your patient for the bad news with a warning shot. For example, the results are not normal. I'm afraid I've got some bad news. Step 6. Give small amounts of information. Give your patient small amounts of information and use pauses and silence. Acknowledge their distress and be prepared to deal with anger and denial. Facilitate the expression of emotion by saying, I can see that was a shock for you. What's going through your mind at the moment? Step 7. Allow questions and check understanding. Allow your patient to ask questions and check their understanding as you go. For example, does that make sense so far? Step 8. Explain details of immediate management plan. Briefly explain the details of the immediate management plan. It is crucial to offer realistic hope. You may be asked directly how long the patient has left to live. In this situation, give some idea without committing to a specific time. For example, we are probably talking about a few months rather than a few years. Step 9. Arrange follow-up. Arrange follow-up, including the use of allied health professionals. Suggest bringing a friend or relative to the next visit. For example, is there anyone you would like to have with you when we next meet in 2 weeks? Top tips for breaking bad news. 1. Use nonverbal empathy to build a rapport, such as voice tone, facial expressions, posture, and eye contact. 2. Be mindful of pacing the consultation according to the patient's needs and concerns. 3. Balance the patient's agenda with the doctor's agenda throughout the consultation. 4. Ask about family and work and consider how these will be affected by the news. 5. Consider using touch if it feels appropriate during the consultation. 6. Try to answer difficult questions regarding prognosis and survival, even if the response is vague. 7. Consider using diagrams to aid in explanation. 8. Provide written information at the end of the consultation. 9. Remember to utilize multidisciplinary professional support, such as specialist nurses, palliative care teams, hospital chaplains, and GPs. 10. Offer a further meeting to speak to family members. 11. Encourage questions. Ensure the patient is not left alone at the end of the consultation and consider who they have at home for further support. When breaking bad news to a patient, there are several common pitfalls that should be avoided. 1. Taking too long to break the news, which can leave the patient frustrated and second-guessing the diagnosis. 2. Using medical jargon without adequate explanation, which can confuse the patient and make them feel helpless. 3. Focusing solely on the doctor's agenda and not taking into account the patient's emotional state and concerns. 4. Talking too much during the consultation, which can prevent the patient from expressing their own thoughts and feelings. 5. Missing important verbal and nonverbal cues, such as when the patient starts crying or looking down at the floor. 6. Rushing the consultation and not allowing enough time for pauses and periods of silence, which can be important for the patient to process the information. 7. Focusing only on the physical aspects of the case and ignoring psychosocial factors, which can be just as important in the patient's overall well-being. In conclusion, delivering bad news is a difficult task, but with the right approach and techniques, it can be done in a compassionate and effective manner. In the video, Mastering the Art of Delivering Bad News, Top Tips and Pitfalls, we have learned valuable insights on how to approach this delicate situation. From understanding the common pitfalls to avoiding them, We have seen how important it is to communicate with empathy, clarity, and honesty. We hope you found this video helpful and informative, and if you did, please consider subscribing to our channel, liking the video, and sharing it with others who may benefit from this knowledge. Thank you for watching, and we'll see you in the next one.